Okay, so you've decided that medical cost sharing is a great catastrophic health option for you and your family, or maybe a few of your employees. That's great. But before you make the leap, it is super important for you to know that not every medical cost sharing community is in the same financial condition. And since you're going to be counting on this to pay your large medical bills, it's a pretty good idea that you know what to look out for. Probably the most common question that people ask when it comes to choosing a medical cost sharing community over traditional health insurance is, what if they run out of money right when it's my turn with a pile of medical bills? In this video, we're going to discuss the telltale signs of a healthy medical cost sharing community and some of the red flags that you need to watch out for. Hi, my name is Art Getz with the Health Benefits Network, where we bring you the latest ideas and innovations about health, healthcare, and health benefits to help make your life better. Now, big expensive healthcare is nothing to sneeze at. And it doesn't happen often, but when it does, oh boy, it can get expensive really fast. Now, some people purchase health insurance to protect against that, while others, they like medical cost sharing as a lower cost alternative instead. And while insurance companies are state regulated, medical cost sharing communities are self-governing. In this video, I'll give you the facts and the right questions to ask to protect you from choosing the wrong medical cost sharing community to join. Both health insurance and medical cost sharing are limited by certain facts. We know that health insurance rates are going to go up over time, mostly because of the profit motives. On the contrary, medical cost sharing rates are more closely aligned to the actual claims being paid. But what's true in both cases is that when claims coming in are greater than the dollars coming in, the money going out to pay bills is going to slow down and the monthly rates, they're going to go up. So whether you're sizing up your current medical cost sharing community and thinking about making a change, or this is your first time, asking these 3 simple questions will keep you from making an avoidable bad choice. First, ask, what is the average time it takes to get your bills paid? Not only is this a big indicator of the health of the community, but you'll most likely have to pay your bills first and wait for the money to come in. That can be pretty frustrating and stressful, especially when you're still paying in every month. Next, you're going to want to ask about any changes in the monthly membership rates. A big jump in monthly rates or multiple increases year after year could be a sign that the community isn't managing things as well as they could be. A healthy cost-sharing community should be able to maintain fairly stable rates with only modest increases year over year. This is a very positive indication that they're doing a good job of negotiating claims and setting monthly rates that are adequate to pay claims and fund reserves. Lastly, it is super important to ask about changes in the community's enrollment, because if the number of members is steadily rising, that's a pretty good sign that the community is healthy and doing a good job for most of its members. On the other hand, if the membership numbers are dropping, this could be the canary in the coal mine, because declining membership is a bad barometer of members' feelings. And if too many people are voting with their feet, it could end in a death spiral where the only people left in the community are the ones with big medical needs. What most people don't realize is that medical cost sharing and health insurance do have some fundamental things in common. Things like people, statistics, and bell curves. And whether you're an insurance company or a cost-sharing community, there's a 100% chance that a small number of people are going to have really expensive medical needs. That's it. The math is the math. Insurance companies are required to keep cash reserves on hand, but cost-sharing communities are not. So in theory, your cost-sharing community could break even every month. That is, if claims equaled contributions, But nobody wants a medical safety net that's broke at the end of every month. You'll want to pick a cost-sharing community that actually has a financial cushion in place. It's just like the concept of working capital in a business. You have to have some cash on hand in order to stay in business. So health-sharing plans that maintain a working reserve are much more likely to have stable rates and reliable sharing communities. This results in faster payments of medical bills and loyal members, which is really important to the stability of any medical cost-sharing community, especially the one that you sign up with. You just need to know that every health share is different, so it's best to narrow it down to a couple of candidates and then ask these few questions. Also, don't forget to read the member reviews and the member guidelines before you sign up. If you've got questions about medical cost sharing or you just need a little help picking the right health share community, check out our sponsor, ScoopHealth.com, for more answers and resources. At Scoop Health, we help people get into the right medical cost-sharing membership, and one of the things that we always look for is a stable rate history. It's really the bedrock of any healthy cost-sharing community. If the rates recently spiked, be cautious. The rate increase could be a sign of bigger problems brewing. A healthy cost-sharing community should be able to maintain stable rates. This is a great sign that they're doing a good job at managing claims and setting rates to cover those claims and fund reserves to level out any variations in the patterns and severity of members' claims. Scoop Health is a strong advocate for medical cost-sharing memberships, and they help individuals and families to look at their whole situation and make a healthcare decision that works best for them. I'd love to share more with you about it and how it works, and I'll leave a link in the description, so please get in touch anytime and we can talk. And don't forget to check out our other videos on this channel, as there are a lot of helpful facts and information about health benefits and healthcare choices that can make your life better. And we'd love to help you make the right choices too. We really want to hear from you, so please leave your comments, questions, and thoughts in the section below. Heck, we might even make a video about your question. If you've gotten value from this video, then please subscribe to our channel, click on that notification bell so we can bring you more healthcare benefit news and stories like this. Show us a little love, click on the button, and be a good friend. Share this video with your colleagues, your employer, and your friends right now, because they all have an expensive health insurance problem too.